My name is Dr. Eva Quiroz, and I'm an infectious disease specialist here at LewisGale Medical Center. We have become a global community, and so it's easy to travel, and the possibility of a pandemic is still looming. The most important thing is to educate people and to be able to share information. I think that the internet has pros and cons, and I think that one of the things that is important about the internet is that you can disseminate information quickly. But then one of the dangerous things about the internet is that you can disseminate false information quickly. Being able to work at the Center for Disease Control and Prevention in Atlanta, it opened my eyes to what goes behind the scenes and how much they have to work to obtain data that is accurate and proven to be able to help people. They have a great resource of information online, and it's accurate, and it helps people understand the disease process better, such as Zika virus recently or West Nile virus, and I believe that they provide accurate information for the community. It happened with Ebola when the Ebola outbreak happened in Africa, and how all the hospitals had special wards and special areas dedicated to the treatment of a potential patient. And when Zika virus also we had the outbreak and the possibility of damage to the baby and brain damage, and then all of those public health interventions and education, it's very important. There's a common fear with vaccination. So the main thing is to be able to communicate what is true or what is scientifically based, and then be able to listen to people and why do they have the fear, and be able to share information. That happens here and abroad as well. There are groups here in the United States who do not believe in vaccination, so we have more outbreaks of measles, mumps, things that were pretty much controlled with vaccine. But there's also a fear of autism and side effects from vaccination, which I think it's important to understand and listen, because both of us can be passionate on both sides of the belief of against vaccination or pro-vaccination. They're pretty strong beliefs, but I think that if we can come and communicate, these are my fears and this is what the data shows, then there's a greater opportunity of preventing illness and preventing the spread of illness. With the world being smaller, in a sense, with possibility of travel, I think that we're just more connected. There's also the possibility of being more connected to do something great, to do something beautiful, and be able to help each other.